Movement problems are the core symptoms of Parkinson's, and they can become more difficult to manage as the disease progresses. In Part 1 of Movement and Falls, we went over how to provide hands-on assistance for standing and sitting. In this video, I will give you some cues you can say to help your loved one walk more easily. We will also go over what to do in case of a fall. Short, shuffling steps are common, increasing risk of tripping and falls. People with Parkinson's often need reminders to take long steps, as automatic motions become more difficult to perform. If the person with Parkinson's has a tendency for the short, shuffling steps to increase at a rapid pace, provide a cue to stop, then start over with big steps. Simply saying slow down will probably not be effective, as the increasing pace is due to an attempt to maintain balance when steps get too small. Concentrate on the size of the step to reduce this problem. Simply repeating big steps can be an effective cue. If the person with Parkinson's has a tendency for freezing, when feet feel like they are glued to the floor, encourage him to stop, straighten his posture, and shift his weight to one foot before beginning to step with the other. Sometimes counting or clapping a rhythmic beat can help reduce the freeze. Other people do better with a cue they can see, such as step over my foot.
When they're moving really, really slow, but other times they're not moving slow. It's not that they're being stubborn, it's just the Parkinson's disease, and if they can just wait a little bit, they'll come out of that freezing type of thing.
Keep cues short and simple, avoiding long explanations which can make processing information harder. Some people with Parkinson's have a tendency to lose their balance backward. In this case, it may be better to position yourself slightly behind the person as he stands at a counter or sink to prevent backward balance loss. An assistive device may improve the person's walking and balance stability. Avoid four-post walkers or quad canes, which are difficult for the person with Parkinson's to move. A walker with wheels may work best. Assistive devices need to have proper fitting and adjustment for safe and effective use. Your physical therapist can help you find the most effective device, adjust it properly, and get it in the best way for insurance reimbursement. If mobility changes do not allow the person with Parkinson's to walk, a wheelchair may be necessary. There are many options. It is important to make sure the chair fits through your home's doorways, into the bathroom, or anywhere else that will be needed to provide care throughout the day. The chair also needs to be fit properly to ensure the user's best posture, positioning, and comfort. Consult with a rehab therapist or other provider who can make a full assessment of the type of chair needed. Falls can happen even when safety precautions are in place. It is important to learn a safe method for helping your loved one up from the ground to avoid injury to both you and the person with Parkinson's. Work with a physical therapist to prepare a system in case a fall occurs. First, it is important to not panic. Take time to make sure the person is not injured and has a chance to rest if needed before trying to get up. Do not try to rise too quickly. Poor planning can lead to a second fall. It is often best to try and have the person scoot to a solid piece of furniture or another object they can use to help pull themselves up. A transfer belt can provide the caregiver a firm grip to help the person as he rises. Work together and make sure everyone knows the plan before starting to get up. If you think it is unsafe to help the person up by yourself, call for help. As you wait for help to arrive, make the person as comfortable as possible. It is important to have a backup plan before the fall occurs. Do you have a friend, relative, or neighbor who can help? Do you need an emergency call button or other system installed in your home to call for help when needed? Know the process to activate an emergency call if needed. Always remember, when helping your loved one move around, do only what you think you can do safely. Both you and the person with Parkinson's should be comfortable and secure.